Let's get started. 1. Critical warning sign. One of the first and most important signs that men over the age of 60 should never ignore is a noticeable change in the shape, firmness, or size of the penis. Contrary to what many believe, this is not simply a natural part of aging. In fact, several studies have shown that these changes could be early symptoms of a connective tissue disorder known as Peyronie's disease, a condition where abnormal fibrous tissue builds up inside the penile shaft, leading to curvature, pain during erection, sexual dysfunction, and even a reduction in penile length. According to a large-scale community-based survey in the U.S. with over 4,000 participants, the prevalence of Peyronie's disease in men aged 60 to 69 is approximately 4%, increasing to 6.5% in men aged 70 and older. Some research suggests the actual number could be even higher, as many cases go undiagnosed due to embarrassment or the misconception that these changes are simply part of getting old. PubMed 2002, Verywell Health 2023. Peyronie's disease develops when the penile tissue undergoes repeated minor trauma, but instead of healing properly, it forms hardened plaques beneath the skin. These fibrous plaques reduce elasticity and lead to abnormal bending when the penis becomes erect. In early stages, men may experience mild discomfort or pain, followed by visible curvature, and, in some cases, a complete loss of erectile function. Approximately 30 to 70% of men with Peyronie's also experience erectile dysfunction, often unaware that the underlying cause is microscopic tissue damage. Early detection is absolutely critical, as intervention is most effective while the fibrous tissue is still soft. Non-invasive treatments, such as penile traction therapy, have been shown to reduce curvature by 20 to 33 degrees, while also restoring length and improving erectile function when applied consistently and early. A 2013 study published on PMC found that men who used traction devices for 2 to 8 hours daily over 6 months experienced significant improvements in both shape and length. Additionally, FDA-approved injectable treatments like collagenase can help soften the plaques, reduce curvature, and improve firmness if used during the disease's stable phase. However, if left untreated, the fibrous tissue may harden completely. At that point, surgery becomes the only viable option, though it carries higher risks and costs. Beyond the physical deformities, Peyronie's disease is also a potential indicator of deeper issues in a man's circulatory and nervous systems. Men with cardiovascular disease, high blood pressure, diabetes, or a history of prostate surgery are at significantly higher risk of developing fibrous plaques. An Italian study showed that men with high LDL cholesterol levels and low physical activity had twice the risk of Peyronie's disease compared to healthy controls. This underscores a vital truth. Penile changes should never be dismissed. They could be early warnings of vascular or neurological conditions that may follow if left unchecked. So if you or any man over the age of 60 notice unusual penile curvature during erection, a loss of sensation, reduced length, or uneven firmness, treat it as a serious medical signal that needs evaluation. Early detection and proper intervention not only help preserve sexual function, but also significantly improve overall quality of life, self-confidence, and most importantly, prevent hidden vascular or neurological diseases. If you've ever noticed unusual changes like curvature, shortening, uneven firmness, or numbness, leave a comment below saying, "I noticed change." It's not just a way to listen to your body, but also a powerful reminder to other men in your generation. Don't forget to like and subscribe to this channel for more in-depth, science-based content about men's health in later life. 2. When the prostate is overloaded. The prostate gland, although not often seen as the center of sexual power, plays an incredibly important and often overlooked role, especially as men age. Science has confirmed that for men over the age of 60, the rate of benign prostatic hyperplasia, BPH, can reach 50 to 60% and continues to rise with age. Among these individuals, approximately 30–40% experience symptoms such as difficulty urinating, frequent nighttime urination, or the sensation that the bladder hasn't emptied completely. Studies show that each time a man ejaculates, the prostate contracts forcefully, an act that, over time, can be physically taxing for this small but vital gland. When masturbation becomes a daily routine, particularly in men aged 60 and above, the prostate may not have enough time to recover between sessions. This can lead to chronic inflammation or swelling. An article published in Urology Journal 2018 reported that excessive ejaculation over extended periods may increase the risk of prostatitis by approximately 20% compared to men with moderate frequency. These issues are often accompanied by more obvious symptoms, including frequent nighttime urination, weak urine stream, dribbling, and a sensation of pain or pressure between the scrotum and rectum. A 2021 study involving 1,200 men aged 60-75 found that over 30% reported at least one of these symptoms, and men who masturbated excessively were 1.5 times more likely to experience them compared to those who did not. In addition, prolonged irritation of the prostate can worsen conditions like BPH, lead to chronic prostatitis, or even mask early signs of prostate cancer. Chronic inflammation can cause PSA, prostate-specific antigen, levels in the blood to rise, complicating cancer screenings and delaying diagnosis. Research published in the Journal of Clinical Urology found that men over 70 who ejaculated daily had PSA levels 25% higher on average than their peers who ejaculated less frequently. So how can men regulate ejaculation in a healthy and science-backed way? According to the European Association of Urology, for men over 60, ejaculation should ideally be maintained at a frequency of 2 to 4 times per week. This helps support prostate function without causing chronic stress to the gland. Long-term studies, 12 months or more, have shown that this frequency can reduce BPH-related symptoms, such as nocturia and urinary difficulty, by 20 to 30%. In addition to regulating frequency, adopting an anti-inflammatory diet rich in omega-3s and fiber, light physical exercise like walking or yoga, and maintaining adequate levels of vitamin D and zinc all play a powerful role in supporting prostate health. A 2022 meta-analysis found that individuals who supplemented with omega-3s and engaged in regular physical activity had an 18% lower risk of developing BPH compared to sedentary individuals with poor diets. Daily masturbation may increase the risk of prostate inflammation and enlargement in older men due to repeated contractions that don't allow sufficient recovery. Studies show that up to 30 to 40% of men over 60 experience symptoms like frequent nighttime urination, weak stream, or the feeling of incomplete bladder emptying. These aren't just inconvenient, they're signs that the prostate may be under stress. Conditions like BPH or chronic prostatitis, if poorly managed, can elevate PSA levels in the blood, complicating early detection of prostate cancer. However, experts emphasize that moderating ejaculation to 2 to 4 times per week, paired with a healthy lifestyle, anti-inflammatory diet, and moderate exercise, can help reduce these symptoms by 20 to 30% and keep the prostate in a more stable condition over the long term. If you're experiencing symptoms such as frequent nighttime urination, difficulty peeing, groin discomfort, or a sensation of prostate tension after ejaculation, leave a comment below saying, "Prostate health matters." This is your space to share experiences, expand awareness, and help protect prostate health as we grow older. Don't forget to like and subscribe so you won't miss any future content, grounded in science, practical insights, and tailored for men navigating health in their later years. 3. Blood flow and vascular health science has clearly shown that the foundation of an erection is not just stimulation, it's healthy, stable blood flow. The vascular system, which includes arteries and veins, plays a central role in both initiating and maintaining an erection. For older men, especially those over 60, the ability to achieve and sustain an erection is heavily dependent on the health of the body's blood vessels. In fact, a comprehensive study from the Mayo Clinic emphasized that erectile dysfunction, ED, can be one of the first warning signs of underlying cardiovascular disease, as the blood vessels in the penis and the heart are often affected simultaneously. As men age, especially beyond their 60s and 70s, the penile arteries become more prone to narrowing due to plaque buildup, reduced elasticity, and weakened ability to expand when needed. Data from the Massachusetts Male Aging Study showed that the prevalence of ED increases from 5% at age 40 to 15% at age 70, with severe cases tripling in that time frame. Stat Pearls, NCBI, 2024. As a result, even if desire remains, many older men struggle to achieve or maintain an erection. Importantly, frequent ejaculation, especially under pressure or high frequency, whether through masturbation or intercourse, can lead to microvascular trauma, tiny tears, in the erectile tissue. According to researchers, these micro-injuries can accumulate over time, resulting in scar tissue that reduces elasticity and places strain on already fragile blood vessels, impeding healthy blood flow. ResearchGate 2011. This is why the old belief that a man's desire equals strength is misleading and potentially harmful. Another condition gaining medical attention is venous leakage, where the veins in the penis fail to trap blood long enough to maintain an erection. In such cases, the erection may occur quickly, but disappears just as fast. Medical sources report that about 5 to 8% of men over 45 experience mild to moderate venous leakage, often resulting in incomplete or short-lived erections. Daily masturbation, especially when done aggressively, can further weaken the venous system and increase the likelihood of this leakage. Fortunately, modern diagnostics now allow for precise evaluation of penile blood flow using penile Doppler ultrasound, which measures arterial inflow, PSV, peak systolic velocity, and venous outflow, EDV, end diastolic velocity. If PSV is below 25 cm or EDV is above 5 cm, this strongly indicates vascular dysfunction, and patients are often advised to undergo cardiovascular assessments due to possible links with coronary or peripheral artery disease. NCBI Bookshelf, Stat Pearls, 2024. Clinically, for men over 60, subjecting penile blowout vessels to constant pressure, such as through daily masturbation, is like flooring the gas pedal on a road full of potholes. It accelerates wear and tear, reduces the body's ability to recover, and steadily weakens erectile function over time. This may result not just in difficulty achieving erection, but also in the troubling pattern of starting strong and then suddenly losing firmness, something many older men are hesitant to admit. Common warning signs include persistent erection difficulties, sudden loss of erection, or inconsistent firmness throughout the process. These should not be ignored. It's important to adjust habits, reduce frequency, allow adequate rest between sessions, and give the vascular system time to heal. Regular light exercise like walking or swimming for 30 minutes a day, combined with a diet that supports vascular health, rich in antioxidants, and helps maintain stable blood pressure and cholesterol, has been shown to improve erectile function by 40 to 60% in older men. If you've ever experienced weak or sudden loss of erection, comment below with "Blood flow matters." Sharing experiences like these not only helps you recognize underlying health signals, but also opens the door for other men your age to realize they're not alone in their journey toward maintaining sexual and circulatory health. Don't hesitate. Sometimes, a single honest comment can spark a meaningful conversation. Be sure to like and subscribe to stay with us for more scientifically grounded, practical, and empowering content on how to boost blood flow and maintain healthy sexual function well into later life. Erections depend on strong, healthy blood flow, and as we age, blood vessels tend to narrow, lose flexibility, and impair circulation. Frequent masturbation can create microtrauma in these vessels, leading to scar tissue and reduced erectile function over time. A commonly overlooked issue in older men is venous leakage, which prevents blood from staying in the erectile tissue long enough. Penile Doppler ultrasound is a key diagnostic tool for assessing vascular health and guiding proper treatment. Ultimately, lifestyle changes, including regular exercise, blood pressure control, and a balanced diet, are vital for protecting vascular health and restoring erectile strength. Keeping your blood vessels healthy is also how you protect your heart, because the penis and the heart share the same core principle of circulation. 4. Nerve sensitivity science clearly confirms that increasing the frequency of masturbation in a repetitive, unvaried manner can cause the sensory nerves in the penis to become desensitized, a condition commonly known as death grip syndrome. This occurs when a man repeatedly uses the same stimulation, strong pressure, fast motion, in identical positions day after day. Over time, the nervous system memorizes this one form of stimulation and becomes less responsive to other, more natural types of touch. As Healthline 2020 explains, men who frequently use intense pressure to reach orgasm gradually need to apply even more force over time, as their nerve endings become less sensitive, leading to a vicious cycle, gripping tighter just to feel the same level of arousal. A 23 meta-review published in the International Journal of Impotence Research also concluded that while masturbation frequency itself may not directly cause erectile dysfunction, unusual or excessive techniques, such as prone-style rubbing, are associated with a 57% higher risk of sexual dysfunction compared to the standard, gentler practices. And this isn't just a problem for young men. It affects older men as well. Research from NCBI 2023 has identified a specific type of nerve that regulates ejaculation, which can be disrupted by overly specific masturbation habits, leading to issues like delayed ejaculation or even anorgasmia, inability to orgasm. Furthermore, Medical News Today 2023 confirmed that temporary numbness is fairly common, but when it persists, it could indicate nerve damage caused by excessive friction or pressure. Nerve sensitivity isn't just about sexual sensation, it's intimately tied to the broader neural network that governs natural physiological response. When sensation diminishes, men often report a lack of emotional connection to pleasure, leading them to increase pressure or change their technique just to feel something is happening. Unfortunately, this only worsens the pressure on nerve tissue and dulls real-life intimacy with a partner. A 2022 meta-analysis from MDPI emphasized that high-frequency masturbation can raise the stimulation threshold, meaning men require stronger stimulation to climax. This creates a behavioral loop, relying on mechanical self-stimulation rather than natural cues, ultimately lowering the quality of pleasure during real intimacy. The good news is that this condition is entirely reversible with behavior change. According to HIMSS under 2020, recovery can begin with a 1-week full break from all sexual activity, followed by a gradual return to gentler forms of stimulation. This means a varying speed, using lighter pressure, and experimenting with different positions, allowing the nervous system to reset and begin responding more naturally again. Medical professionals also recommend increasing variation, using lubricant, changing hand positions or angles, taking breaks during stimulation, and eventually reintroducing partner intimacy as part of reestablishing a healthy neural response. Additionally, when sensitivity is reduced, many men benefit from incorporating mindfulness or meditation. Focusing on the present moment can help the nervous system reconnect with more subtle sensations, encouraging natural responses without the need for aggressive stimulation. Medical News Today supports mindfulness techniques as a valuable tool in the nerve recovery process. If you've ever found yourself saying, "I can get hard, but I can't feel much," leave a comment below. Nerve reset in progress. Share your experience. Together, we can practice a gentle, science-backed approach to resetting the nervous system and rediscovering authentic pleasure. 5. Hormonal impact science has clearly shown that testosterone is far more than just a sex hormone. It plays a central role in muscle strength, emotional stability, daily energy levels, motivation, and the ability to focus. According to a major study published in the Journal of Clinical Endocrinology and Metabolism, 2021, men over the age of 60 have, on average, 30% lower testosterone levels compared to when they were in their 30s and 40s. Chronic low testosterone, also called hypogonadism, affects around 20 to 30% of men aged 60 to 70 and nearly 40% of those over 70. Notably, ejaculation frequency has also been identified as a potential factor affecting testosterone levels, especially when proper recovery is not allowed. Here's how the physiology works. When a man orgasms, his body enters a cooling phase, marked by a sharp drop in testosterone and a spike in cortisol and prolactin. In younger men, hormones bounce back quickly, usually within hours. But in men over 60, hormonal recovery takes longer. If ejaculation happens too frequently, say nearly every day, the body doesn't have enough time to return to baseline testosterone levels. The result? The next day's testosterone may remain below normal, and this pattern can continue for weeks or even months if habits don't change. A systematic review of 15 studies published in Fertility and Sterility, 2022, found that among older men, ejaculating 5 to 7 times per week was linked to 10 to 15% lower testosterone levels compared to those who limited frequency to 2 to 3 times per week. This suggests that daily masturbation or intercourse, without proper balance, may contribute to chronically low testosterone in aging men. The consequences are clear. Men with chronically low testosterone often experience persistent fatigue, mild depression, loss of motivation, muscle loss, poor sleep, and difficulty concentrating. These issues may develop slowly, but over time, they have a profound impact on quality of life. To maintain hormonal balance in later life, science recommends limiting ejaculation to 2 to 4 times per week, allowing the body sufficient time to stabilize hormone levels and avoid repeated hormonal crashes. In addition, sleep plays a crucial role. A study published in the American Journal of Physiology, Endocrinology and Metabolism, 2020, showed that sleeping 7 to 8 hours per night can increase testosterone levels by up to 15% compared to those who sleep less. Deep, consistent sleep aligned with circadian rhythms also aids hormone regeneration, muscle recovery, and emotional well-being. Physical activity, especially resistance training like weightlifting, has also been proven to benefit the hormonal system. Long-term studies show that older men who engage in strength training at least 3 times per week can naturally boost testosterone levels by 10 to 20%, while also reducing insulin resistance and increasing lean muscle mass, 2 critical factors for maintaining overall male health. Diet is another essential piece of the puzzle. Experts recommend prioritizing healthy fats, such as omega-3s, from fatty fish or flax seeds, and ensuring adequate intake of zinc, vitamin D, and magnesium from whole foods. These nutrients act as cofactors in the body's natural testosterone production. In contrast, consuming refined sugar, alcohol, or processed foods regularly can raise cortisol levels, a hormone that counters testosterone, and trigger long-term hormonal imbalance. In short, testosterone is a vital hormone, not only for libido but also for energy, strength, mood, and cognitive clarity. Ejaculating too frequently, particularly for men over 60, can lower baseline testosterone by 10 to 15%. When combined with poor sleep, chronic stress, or medication overuse, the risk of hormone deficiency becomes even greater. That's why protecting hormonal stability means adjusting masturbation frequency, ensuring quality sleep, committing to regular exercise, and eating in a way that supports endocrine function. If you've ever felt like the more you do, the lower your testosterone drops, leave a comment below. Hormone balance needed. Share your story or even just a question so we can help one another maintain youthful energy, emotional resilience, and physical vitality well into our 60s and beyond. 6. Growing habit of self-isolation, impact on mental health and longevity. Science has made it clear. Psychological loneliness is not just an emotional state, it's one of the most dangerous factors affecting the health of older men. A study by the American Psychological Association 2020 found that feeling socially isolated increases the risk of early death by 26%, a risk equivalent to obesity or smoking. Among men over 65, the impact of isolation is especially profound. They are significantly more prone to depression, anxiety, and cognitive decline compared to peers with stable social relationships. When daily masturbation becomes a primary source of pleasure or a stress relief mechanism, some individuals may easily fall into a self-isolating cycle. They begin to withdraw from real-life conversations, avoid emotional connections, and distance themselves from intimate partners. This withdrawal reduces the production of oxytocin, a hormone vital for emotional bonding. According to the National Academy of Sciences 2015, a lack of oxytocin and dopamine from genuine social interactions can reduce up to 90% of positive experiences, leaving the mind in a hollow, emotionally numb state. The habit of masturbating alone forms a negative feedback loop. The body still releases dopamine, but without any real-world social context to complete the emotional experience. Over time, the brain becomes conditioned to internal pleasure alone, reducing the desire or emotional capacity to seek connection. A 2019 study published in The Lancet found that men over 70 who were frequently isolated had 2 to 3 times faster cognitive decline, along with a 29% increased risk of early death compared to those with regular social interaction. Psychological isolation doesn't just affect emotions, it directly shortens lifespan. According to the Proceedings of the National Academy of Sciences, 2021, older adults living in solitude have an average life expectancy that is 4.5 years shorter than those with deep social networks. They're also at higher risk for chronic illnesses such as cardiovascular disease, stroke, and diabetes, all common in older age. This condition also spills into emotional well-being, often causing mild depression, loss of motivation, irritability during social interaction, and even withdrawal from family, despite a deep inner need for connection. The National Institute on Aging, 2020, reports that adults facing psychological isolation in midlife and beyond are more likely to experience sleep disturbances, emotional overeating, and short-term memory lapses. The good news? Recovery is highly possible with the right intervention. A clinical trial involving 1,200 older adults found that participation in social connection programs, such as book clubs, light dance classes, or walking groups, reduced the risk of early death by up to 43% over 2 years. Participants also reported better sleep and an improved heart rate by approximately 7 beats per minute. British Journal of Psychology, 2022. So what's the solution? First, recognize the habit of self-isolation. For example, when you choose masturbation over meeting friends, decline invitations to go out, or feel safer being alone. Then set weekly connection goals. Just one phone call, one coffee with a relative, or a chat with an old friend. According to Psychology Today, 2021, as little as 2 hours of social interaction per week can significantly reduce depression and delay cognitive decline. Additionally, try joining community activities that suit your pace, such as volunteering, enrolling in a hobby class, or joining a wellness group. These naturally trigger the release of oxytocin and endorphins, improving emotional connection, lowering anxiety, and helping sustain long-term energy and joy. Psychological loneliness increases the risk of early death by up to 26% and can reduce life expectancy by up to 4.5 years in older adults, according to major health organizations like the American Psychological Association and the National Institute on Aging. When masturbation becomes a daily habit without being balanced by meaningful social connection, it can lead to a state of self-isolation, not because of masturbation itself, but because it gradually replaces the social experiences essential to human emotional and physical health. Prolonged isolation not only impairs cognition and increases the risk of depression, but also negatively affects sleep, mood, and cardiovascular health. In contrast, engaging in community life, group exercise, regular conversation with friends, or simply calling a loved one each week can reduce early mortality risk by up to 43% and significantly improve both physical and mental well-being. If you feel you're slowly withdrawing from family, speaking less, or finding comfort only in solitude, leave a comment below. Breaking isolation. Let's step into the light together. Connect, share, and live each day with more purpose and meaning. 7. Should you stop masturbating completely? Experts have long emphasized that masturbation is not a bad habit, but a natural behavior that can offer benefits, if done with the right frequency and technique. Reports from both the American Urological Association and the Mayo Clinic agree. Masturbation can help relieve stress, improve mood, and does not harm the genitals when not done excessively. The real concern arises when it begins to replace other psychological needs, such as emotional connection, social support, or even healthy sleep. When that happens, the body and mind miss out on the diverse types of stimulation needed to sustain long-term health. Science shows that a habit considered healthy at 25 can become a burden at 65 because the aging body no longer recovers as quickly or thoroughly as it once did. A 2022 analysis published in the Journal of Sexual Medicine found that among men over 60 who masturbated daily, 35% reported persistent fatigue, reduced pleasure, and lower baseline testosterone levels compared to those who limited frequency to 2 to 4 times per week. This points to a clear truth. Frequency and technique are the key factors that determine whether masturbation is beneficial or harmful for older men. Multiple studies show that reducing frequency to 2 to 3 times per week significantly improves various health markers. According to the European Urology Association, men who lowered their masturbation frequency from daily to this moderate level saw better hormonal balance, reduced signs of prostate inflammation, improved erection quality and sensation, and enhanced mental well-being. Lower frequency gives the body time to recover, protecting the vascular, nervous, hormonal, and emotional systems from chronic overload. But it's not just about how often. How you masturbate matters just as much. Research from the Journal of Andrology recommends gentle pressure, moderate pace, varied positions, and the use of lubricants to minimize friction and preserve penile sensitivity. Diverse forms of stimulation also help the nervous system maintain a wide range of sensory responses, reducing the risk of phallic conditioning, where the penis becomes conditioned to respond only to one specific form of stimulation and not to real-life intimacy. Additionally, psychologists from the American Psychological Association note that if you're using masturbation as a tool for emotional regulation, say to relieve stress, loneliness, or numbness, it should be balanced or replaced with healthier activities like meditation, yoga, group participation, or even just talking with a close friend. These approaches help reduce dependence on masturbation for emotional comfort while reinforcing emotional connection and mental resilience. Masturbation is a natural and potentially beneficial behavior, especially for older men, when practiced in a mindful and moderate way. But when it becomes a daily, unchecked habit, it can quietly lead to a range of negative outcomes, many of which go unnoticed by men over 60. Overuse can result in persistent fatigue, reduced sexual pleasure, hormone imbalance, and loss of penile sensitivity due to prolonged overstimulation of the nervous system. Recent studies show that cutting down masturbation frequency to around 2 to 3 times per week significantly improves testosterone levels, erection quality, sleep, and emotional connection in real-life relationships. Beyond frequency, technique matters deeply. Instead of rushing through sessions with intense pressure and fixed positions, older men are encouraged to explore gentler, more varied techniques and use lubricants to avoid micro-trauma. This helps preserve natural sensitivity and rebuild the brain-body connection that often fades with age. Moreover, if you find yourself using masturbation to escape stress, loneliness, or underlying sadness, consider replacing part of that routine with healthier alternatives like walking outdoors, playing music, or catching up with a close friend. These activities have been proven to trigger the brain's natural production of happiness hormones like oxytocin and serotonin, supporting emotional balance and long-term mental health. If you've ever thought masturbating every day might be doing more harm than good, leave a comment below. Balance over habit. Let's share the commitment to mindful change for lasting sexual health and a richer, more connected life after 60. Once you've passed the age of 60, your body and mind no longer function the way they once did. But it's exactly in this stage of life that if you learn to listen closely to even the smallest changes, adjust accordingly, and live in harmony with your true needs, you can absolutely preserve your vitality, emotional closeness, and a genuine quality of life. Today's video is not just a cautionary message about the effects of daily masturbation, it's also a gentle reminder. Your body deserves respect, care, and conscious affection. The lessons you take from this aren't just about protecting sexual health. They're the keys to maintaining confidence, happiness, and emotional connection, things that are deeply precious in our later years. If today's video helped you reflect on your habits and think differently, leave a comment below. I choose proactive health. We would love to hear your thoughts, not just to support you, but to build a strong, mature community of men who understand themselves and live healthier every day. And if you want to learn more about how to naturally improve your sexual vitality in later life, or how to sustain healthy testosterone levels long-term, watch the video now showing on your screen, or choose another from the recommended list beside it. Each one is carefully crafted just for you. Thank you for taking the time to listen. And remember, no matter your age, you still have the power to take charge of your quality of life. See you in the next video.